Okay, ladies and gentlemen, it's time to go through our second presidential candidate statement on healthcare reform. This one is Donald J. Trump. You find it at donaldjtrump.com. And if you click on the positions menu link at the top, you'll be able to select one that says healthcare, and that'll bring you to a page. And that's where I'm going to start. Donald Trump's vision. To view Mr. Trump's position, visit, and then it gives you a link to another website for a much more inclusive statement on his healthcare reform proposal. But I'm going to read through what's under that. There's a lot of bullet points and then some key issues. I'll read those to start with on this page. First bullet point: repeal and replace Obamacare with health savings accounts. Next, work with Congress to create a patient-centered healthcare system that promotes choice, quality, and affordability. Next, work with states to establish high-risk pools to ensure access to coverage for individuals who have not maintained continuous coverage. Allow people to purchase insurance across state lines in all 50 states, creating a dynamic market. Maximize flexibility for states via block grants so that local leaders can design innovative Medicaid programs that will better serve their low-income citizens. Okay, this refers to when a lot of the governors in some states, it was mentioned in the Hillary Clinton plan, did not participate in Obamacare and therefore did not receive the funding that it provided to expand Medicaid services. The idea is, instead of earmarking funds that the federal government is giving for healthcare to states, having strings attached to it, just giving them a block of funds so they can decide how best to distribute it among their citizens. And the goal being to get that money that would have been coming through an Obamacare or Affordable Care Act type of pathway to be available for the patients to use however they like, hopefully for health services for the indigent, which is what it was intended for. Key issues. President Obama said his health plan would cut the cost of family premiums by up to $2,500 a year. Instead, premiums have gone up by almost $5,000 since Obamacare passed. That's according to the Kaiser Family Foundation. Nearly 2/3 of Obamacare exchange plans lost over $2.2 billion just in 2014. That's according to the Mercatus Center, April 22, 2016. Health insurance companies are fleeing the Obamacare exchanges. 5 states, 1/3 of all counties, and 19% of Americans eligible for Obamacare will have only one exchange insurer this year. That's an article in the New York Times, August 19th, 2016. The Kaiser Family Foundation, August 28th, 2016, and McKinsey on Healthcare, August 18th, 2016. Premiums have skyrocketed across the nation with a national average of almost 25%, with some states experiencing rate increases up to 70%. In Iowa, one plan got a 43% increase approved. In Florida, the individual market will see an average rate increase of 19%. In Pennsylvania, at least 3 plans requested rate increases over 40%, and the average rate requested in Minnesota is 54%. That's according to ACA signups, Health Insurance, the Miami Herald, and Health Insurance. And these links I have not been following off of his page, but there are links in the actual page if you're following with me. More than half of the exchange plans have deductibles of $3,000 or more. That's according to the New York Times, November 14th, 2015. Deductibles are going up in 2015, some as high as $7,000 per person on the cheapest Obamacare plans. That's according to Investors Business Daily, May 13th, 2016. People are going without needed medical coverage because they can't afford these amounts. That's in the Boston Globe, November 16, 2015. Okay, this is the first one where I'll actually pipe in and say, absolutely, we've seen this in our own practice of patients going bare because the insurance is too expensive. Most of the people getting covered under Obamacare are getting it through the government-run Medicaid program. That's according to the Heritage Foundation. Almost 12 million more Americans were enrolled in Medicaid or the Children's Health Insurance Plan, also called CHIP, since October 2013. That's ObamaCareFacts.com. By 2026, 1/4 of our population will be on Medicaid or the Children's Health Insurance Program. That's according to the Congressional Budget Office, March 2016. Numerous studies show that Medicaid enrollees can't find doctors. That's the Department of Health and Human Services Office of the Inspector General, December 2014. I'll also pipe in here and say, yes, it is difficult for Medicaid enrollees to find a doctor who will take them. Medicaid beneficiaries have worse health compared to everyone else. Add that to higher death rates, misuse of the emergency room, and higher overall costs. That's from How to Fix Medicaid, National Affairs 2014. I will say that could be a deceiving statement in that it may not be all Medicaid's fault that they're in worse health and higher death rates. People are already in a poor state when they qualify for Medicaid and are likely to be in the best of health coming into it. So it may not be the Medicaid's fault. Could also be because of Medicaid care that there's worse health and higher death rates. But it's not necessarily causative that those go together. One is not necessarily causing the other. Obamacare has reduced pay for workers and small businesses and reduced employment by more than 350,000 jobs nationwide. That's according to American Action Forum, September 9th, 2016. As a small business owner, I can tell you it is a bit of a hardship to have to provide health insurance for your employees. The employer mandate raised the minimum cost of hiring a full-time worker to $10.30 per hour for larger employers without increasing take-home pay for workers, according to the Heritage Foundation. Okay, without increasing take-home pay, but it may have increased benefits. State and local officials have conceded that Obamacare forced municipal governments to cut hours of part-time employees. That's according to the New York Times, February 20th, 2014. I've heard this argument before, that when you require healthcare to be given as a benefit to employees with a certain number of hours, it is an incentive for employers to cut hours for their employees. State and local officials have conceded that Obamacare forced municipal governments to cut hours of I just said that. University of Wisconsin cut back student workers' hours as a result of Obamacare. Same thing. Madison, September 27, 2016. Contrast with Hillary Clinton. Hillary Clinton will protect and expand disastrous Obamacare. She called Obamacare, quote, one of the great accomplishments not only of this president, but of the Democratic Party. Going back to Harry Truman, end quote. That's from CNN Money, August 19, 2016. Hillary Clinton will provide Obamacare to illegal aliens. Hillary Clinton issues healthcare, which we referred to in our previous video. 35% of the uninsured are illegal aliens who are already getting free care in our emergency rooms. That is being paid for by American taxpayers. That's according to the Congressional Budget Office, March 2016. The issue here to be considered is, are you going to pay less for care for these people by providing them primary care, or paying for the emergency department, or even going on to another consideration of somehow not providing care to people who enter emergency departments with a medical emergency? Hillary Clinton will offer public option on the exchanges, driving out private health plans and leaving Americans with fewer options and eventually no choices but a government-run plan. Well, okay, if you extrapolate out what is being proposed by the Hillary Clinton proposals and the direction that things are going, you could imagine that that could be the outcome. Yeah. Okay, let's go to the link that is provided, which is www.donaldjtrump.com/position/healthcare-reform. And that gets us to a 4-page PDF document that we'll go through on this video. Healthcare reform. You can read along with me if you want. It's at assets.donaldjtrump.com/healthcare_reform.pdf. Since March of 2010, just ignore the mouse in the background. Since March of 2010, the American people have had to suffer under the incredible economic burden of the Affordable Care Act, Obamacare. This legislation passed by totally partisan votes in the House and Senate and signed into law by the most divisive, or is it pronounced divisive, and partisan president of the United in American history, has tragically but predictably resulted in runaway costs, websites that don't work, greater rationing of care, higher premiums, less competition, and fewer choices. I will say it's not because of it that my website didn't work for a few hours on one weekend. Since March of 2010, the American people have had to suffer under the incredible economic burden of the Affordable Care Act, Obamacare. This legislation passed by totally partisan votes. I know it sounds like I'm repeating myself, but I'm actually reading the next paragraph, which is the exact same thing. Until you get to a certain part. Totally partisan votes in the House and Senate and signed into law by the most divisive and partisan president in American history was tragically but predictably resulted in runaway costs, websites that don't work, greater rationing of care, higher premiums, less competition, and fewer choices. Obamacare has raised the economic uncertainty of every single person residing in this country. As it appears, Obamacare is certain to collapse of its own weight. The damage done by the Democrats and President Obama and abetted by the Supreme Court will be difficult to repair unless the next president and a Republican Congress lead the effort to bring much needed free market reforms to the healthcare industry. But none of these positive reforms can be accomplished without Obamacare repeal. On day one of the Trump administration, we'll ask Congress to immediately deliver a full repeal of Obamacare. Okay, I'll say it here. I have concerns about a full repeal of Obamacare. Are we going to protect people with pre-existing conditions? Are we going to protect women who now, under Obamacare, have equal premiums as men? That's not being said here. I hope it's the case if they were to put this into place, but they're not saying that they would do that. However, it's not enough to simply repeal this terrible legislation. We'll work with Congress to make sure we have a series of reforms ready for implementation that follow free market principles and that will restore economic freedom and certainty to everyone in this country by following free market principles and working together to create sound public policy that will broaden healthcare access, make healthcare more affordable, and improve the quality of the care available to all Americans. Any reform efforts must begin with Congress. Since Obamacare became law, conservative Republicans have been offering reforms that can be delivered individually or as part of more comprehensive reform efforts. In the remaining sections of this policy paper, several reforms will be offered that should be considered by Congress so that on the first day of the Trump administration, we can start the process of restoring faith in government and economic liberty to the people. Congress must act. Our elected representatives in the House and Senate must. Okay, I'm a little disturbed by this. That day one of being in office, he's repealing it, but he's not replacing it. He's instead telling Congress, now you replace what I just repealed. Again, no protections for people with pre-existing conditions and women having the same equal premiums. Number one, completely repeal Obamacare. Our elected representatives must eliminate the individual mandate. No person should be required to buy insurance unless he or she wants to. Okay, there's a problem that has to be addressed in this where a person is not required to buy insurance, which I understand not wanting to require people to have to do something with their money. I get that. But we are still faced with the issue of what happens when they have catastrophic healthcare costs and some degree of care is given to them because they are in a medical emergency, and that's just what we do in medicine. We take care of people in a medical emergency. Resources will be used and it's a difficult situation to not deliver that care when our calling and position has been to take care of people. Okay, so I'm sure there are people on one camp that will probably say, just don't take care of them, which just simply isn't going to happen. They will be taken care of. We will take care of people in medical emergency. That, again, we have an oath and we have a calling, even though some people try to not have an oath and a calling in medicine. Number two, modify existing law that inhibits the sale of health insurance across state lines. As long as the plan purchase complies with state requirements, any vendor ought to be able to offer insurance in any state. By allowing full competition in this market, insurance costs will go down and consumer satisfaction will go up. Sort of. Yes, you can have competition for healthcare plans, but again, that's not healthcare. Healthcare is when you get a bill from a doctor for something they did for you, or you compare what one doctor is charging against what another one is and making your decision there. Let me just say this right now. When it comes to competition in healthcare, and actually the Donald Trump plan sounds more in favor of patients knowing what healthcare costs are and actually playing a role in deciding what's spent. So I do like that. And here's what I have to say about that. I have seen an explanation of benefits from a competitor, a large group in my town, and compared it with the exact same billing codes that go to the insurance that get paid a certain amount according to contract, and seeing that this other provider in town providing the exact same billing code for primary care services got paid twice what we do. We're providing the exact same billing code, exact same service in the same town. In fact, within a block of each other. So it would be nice if whoever's making decisions, and I'd love for it to be patients, could look and see, oh, I can go Auburn Medical Group, pay half as much and get great quality care, personalized care in healthcare, rather than go to the big group and get lost as a number in that huge institution. Okay. Number 3, allow individuals to fully deduct health insurance premium payments from their tax returns under the current tax system. Businesses are allowed to take these deductions, so why wouldn't Congress allow individuals the same exemptions? As we allow the free market to provide insurance coverage opportunities to companies and individuals, we must also make sure that no one slips through the cracks simply because they cannot afford insurance. We must review basic options for Medicaid and work with states to ensure that those who want health care coverage can have it. And this is very reassuring to me because I wasn't sure I would see a provision for Medicare for those who are falling through the cracks in the Obamacare plan. So I'm glad to see that. Number 4, allow individuals to use health savings accounts. Contributions into HSAs should be tax-free and should be allowed to accumulate. I like that. These accounts would become part of the estate of the individual and could be passed on to heirs without fear of any death penalty. No, he does not mean they're going to kill the heirs. He means a penalty because of inheritance. These plans should be particularly attractive to young people who are healthy and can afford high deductible insurance plans. These funds can be used by any member of the family without penalty. The flexibility and security provided by HSAs will be of great benefit to all who participate. I love the sound of that. I think that sounds great. Require price transparency from all healthcare providers, especially doctors and healthcare. I love it. Healthcare organizations like clinics and hospitals, because we are going to be your best value, besides providing excellent care. And truly, care is the key word there when it comes to the Auburn Medical Group and the people here. Our patients will tell you. Okay, enough of a commercial for myself here. Let's get back to the business. Individuals should be able to shop to find the best prices for procedures, exams, and any other medical related procedure. I'm with you there. 6, block grant Medicaid to the states. Nearly every state already offers benefits beyond what is covered in the current Medicaid structure. The state governments know their people best and can manage the administration of Medicaid far better without federal overhead. States will have the incentives to seek out and eliminate fraud, waste, and abuse to preserve our precious resources. So this is in contrast to the current Affordable Care Act that was giving Medicaid money to expand Medicaid when the states didn't want to have to expand it, so they didn't get that money. The idea is you'll just get all the Medicaid money without strings attached. 7, remove barriers to entry into free markets for drug providers that offer safe, reliable, and cheaper products. Congress will need the courage to step away from the special interests and do what is right for America. Though the pharmaceutical industry is in the private sector, drug companies provide a public service. Wow. That's sounding a lot like the Hillary Clinton plan right there. Allowing consumers access to imported, safe, dependable drugs from overseas will bring more options to consumers. The reforms outlined above will lower healthcare costs for all Americans. They are simply a place to start. I agree with that. This is not the full answer. And so I'm glad they recognize that and saying it's a place to start. There are other reforms that might be considered if they serve to lower costs, remove uncertainty, and provide financial security for all Americans. And we must also take actions in other policy areas to lower healthcare costs and burdens, enforcing immigration laws, eliminating fraud and waste, and energizing our economy will relieve the economic pressures felt by every American. It is the moral responsibility of a nation's government to do what is best for the people and what is in the interest of securing the future of the nation. Providing health care to illegal immigrants costs us some $11 billion annually. If we were to simply enforce the current immigration laws and restrict the unbridled granting of visas to this country, we would relieve healthcare cost pressures on state and local governments. Okay, for the immigrants who are already here, they are still getting the care. Just because you're not giving them a primary care physician does not mean there's not expense to us in providing care. Now, if you were to do something to prevent immigrants from increasing by keeping them from coming into the country, that would keep some cost from increasing at that point. To reduce the number of individuals needing access to programs like Medicaid and Children's Health Insurance Program, or CHIP, we will need to install programs that grow the economy and bring capital and jobs back to America. The best social program has always been a job, and taking care of our economy will go a long way towards reducing our dependence on public health programs. Okay, that reaches beyond healthcare policy, so I won't comment on that. Finally, we need to reform our mental health programs and institutions in this country. Families without the ability to get the information needed to help those who are ailing are too often not given the tools to help their loved ones. There are promising reforms being developed in Congress that should receive bipartisan support. I'm also all for that. To reform healthcare in America, we need a president who has the leadership skills, will, and courage to engage the American people and convince Congress to do what is best for the country. These straightforward reforms, along with many others I have proposed throughout my campaign, will ensure that together we will make America great again. So that is the Donald Trump program. I am going to summarize in the next video both Gary Johnson and Evan McMillan. So stay tuned for those. Again, please do comment below if you have comments about this video and its content, or if you have anything you want me to do in future videos. Thanks for tuning in.